Administering oral medications. The patient will swallow the prescribed medication at the proper time. Gather equipment. Check each medication order against the original in the medical record according to the facility policy. Clarify any inconsistencies. Check the patient's chart for allergies. Note the actions, special nursing considerations, safe dose ranges, purpose of administration, and adverse effect of the medications to be administered. Consider the appropriateness of the medication for this patient. Perform hand hygiene. Move the medication cart to the outside of the patient's room or prepare for administration in the medication area. Unlock the medication cart or drawer. Enter passcode if required. Prepare medication for one patient at a time. Read the MAR and select the proper medication from the patient's medical drawer or unit stock. Compare the label with the MAR, check the expiration dates, and perform calculations if necessary. Scan the barcodes on the package if required. Prepare the required medications for unit dose package. Place unit dose package medications in a disposable cup. Do not open the wrap until at the bedside. Keep narcotics and medications that require special nursing assessments in a separate container. For multi-dose containers, when removing tablet or capsules from a multi-dose bottle, pour the necessary number into the bottle cup and then place the tablets or capsules in the medication cup. Break only the score tablet if necessary to obtain the proper dose. For liquid medication in multi-dose bottle, when pouring liquid medication out of the multi-dose bottle, hold the bottle so that the label is against the palm. Use the appropriate measuring device when pouring liquids, and read the amount of medication at the bottom of the meniscus at eye level. Wipe the lid of the bottle with a paper towel. When all medications for one patient had been prepared, recheck the labels with a CMAR before taking the medication to the patient. Replace any multi-dose containers in the patient's drawer or unit stock. Lock the medication cart before leaving it. Transport medication to the patient's bedside carefully and keep the medication inside at all times. Ensure that the patient receives the medication at the correct time. Perform hand hygiene and put on PPE if indicated. Identify the patient. Usually the patient should be identified using two methods. Compare the information with the CMAR. Check the name and identification number on the patient's identification band. Next is to ask the patient to state her name and birth date based on facility policy. If the patient cannot identify herself, verify the patient's identification with a staff member who knows the patient for the second source. Scan the patient's barcode on the identification band if required. Complete necessary assessments before administering medications. Check the patient's allergy bracelet or ask the patient about allergies. Explain the purpose and action of each medication to the patient. Assist the patient to an upright position and administer medications by offering water and other fluids with pills, capsules, tablets, or some liquids medication. Ask the patient whether she prefers to take medication by hand or by cup. Remain with the patient until each medication is swallowed. Never leave medication at the patient's bedside. Assist the patient to a comfortable position. Then document the administration of medication immediately after administration. Evaluate the patient response to medication within appropriate time frame. Then remove PPE if used and perform hand hygiene.